starting to see a good number of folks as well as many of our panelists. So I'll start in with a very brief introduction. My name is Jen Cool. I work at the Global Climate and Health Alliance as the Network and Engagement Lead. And I'm so excited to have you all here and joining us today. I think one of the really unique things about GCHA is that because we're working at the intersection of health and climate, we really hear from both sides quite often. And we've heard over the years, a lot from health organizations that we work with and our partners in the African continent about the challenges that climate change is bringing, from new diseases in places where there didn't used to be malaria. There's malaria in the highlands, and there are droughts and water scarcity, as well as flooding. And then at the same time, we hear from folks working on climate justice and environmental justice, that the fossil fuel industry is making a play for both extraction and sales on the continent. And I think we have this unique position of being able to hear both sides, but we're starting to get the sense that people didn't know each other. So really the goal and hope of this conversation was to start having the health folks and the climate folks start talking to each other, particularly around fossil fuels, because it's not that useful if we as an international organization are hearing it, but we're not, creating spaces for you all to connect with each other. And we're also really fortunate and excited to work on this conversation with folks from groundwork, and from my Portuguese is not great. Justicia Ambiental, Mafoko and Deepti. And I also want to shout out and introduce you to my colleague Shweta. I don't know, Shweta, if you want to come in and say anything before we kick it over to the panelists.
Thank you, Jen, and thank you so much for facilitating and organizing this. And as you said, I think the whole idea of, and this is the beginning of a series of conversation, is to facilitate a dialogue between climate justice community, health justice community, environmental justice community, because the problems are the shared in nature, and so should the solutions be. And with that, keeping that in mind, we are, this is the first of a series of dialogue that we are convening, and we're very excited about it because we're seeing good interest. Thank you all for making the time, and I'm not going to hold this conversation anymore, Jen, over back to you. But just to say that I'm very grateful for everybody to be here.
Great. Thanks so much. All right, so we've got I'll just briefly say something about the structure of the event, and then I will stop talking. We're going to structure this with two panels, hearing first from those who are knowledgeable about the health harms, and then we'll hear of fossil fuels particularly, and then we'll shift over to hear from folks who have ideas about what a just transition could mean for the African continent. And then we're going to close with remarks from health leaders, speaking, kind of reflecting on what they have heard from the two panels before we turn it over to you for some questions. And I see folks are doing it already, but if you want to take a chance to introduce yourselves in the chat, that would be fantastic. All right, and with that, Mafoko, can I turn it over to you to get us started?
Hi, Jen. Hi, everybody. Thank you. I'm just going to share a few slides for context. Let me know when you can see them.
Yeah, there we go.
Okay, great. Thank you. Thank you so much. My name is Mafoko Pamani, and I'm an environmental health campaigner at Groundwork, and we're also Friends of the Earth South Africa. Just by way of context and a little bit about what's happening in South Africa. In South Africa, the Mpumalanga Highveld is known for air pollution, but generally South Africa's reliance on coal as its primary energy source has led to the country being the most energy and carbon intensive countries in the world. And the Highveld is currently home to 12 of Eskom's 50 stations, and the area is crippled with socioeconomic challenges, unemployment, poor health, and the lack of education. And so air pollution has been a feature of this landscape in the 1950s. And in 2017, the area was declared a priority area, signifying the exceedances of emissions happening there. Particularly looking at health, the infographic in front of you was from a study led by Dr. Mike Holland, who undertook some modeling to indicate the health impacts of air pollution due to Eskom's coal-fired power stations. And as you can see, over 2,000 premature deaths per year are attributable to coal-fired power, to coal-related air pollution, heart disease, lower respiratory infections, lung cancer, including thousands of cases of bronchitis and asthma, both for adults and children. And this costs the health system close to 30 billion rand in annual in hospital admissions. And so the health sector is impacted greatly. And many of you may know about the deadly air case, which was heard in 2019, where environmental justice groups, Groundwork, Vogani Environmental Movement, were represented by the Center for Environmental Rights. And the case was brought against the government on grounds that the government is in violation of the people's constitutional right to live in an environment that is not harmful to their health and well-being. And in March 2022, the court found in the people's favor in that the poor air quality is in direct breach of the people's constitutional right to breathe clean air and to live in an environment that is not harmful to their health and well-being. And so the court ordered the minister to prescribe regulations that would put in effect industry complying with air quality standards. The regulations were published and the minister appealed the case, but earlier this year, the minister's appeal case was dismissed. And so, but currently, despite this victory, people in the Highveld are still experiencing challenges due to air pollution. And we're seeing that exemptions are being granted to industry and to Eskom. And moving forward to another strategic litigation case called the Cancel Coal case. This is South Africa's first youth-led climate litigation, where the Africa Climate Alliance and Vogani Environmental Movement, as well as Groundwork, launched this case that was in relation to the state wanting to procure a new coal-fired power. And so the case, asserts that these plans are inconsistent with, firstly, the Constitution, but looking at imminent climate harms in water pollution, health impacts, and various socioeconomic harms will persist if new coal-fired power is procured. And so in December last year, 2024, the courts concluded that procuring this new power would be unlawful and it is invalid. And so the negative impacts would be directly felt by children. This would be in direct contravention of children's constitutional rights to living in an environment that is not harmful, but also their health would be impacted. And currently the minister has appealed the whole case, and we are waiting to see how that unfolds. And I think the case really reinforces the need for transparency and public participation in making processes, but also in relation to as the health sector, when we do continue to advocate, we need to for the just transition from fossil fuel-based energy And we also need to, propose radical changes to our various health systems on the continent. Um, thank you, Jen. I'll leave it there.
Thank you so much, Mafalko. That was so concise and so clear. Also, so often we are sold on the benefits of fossil fuels for economies or for energy, but I think this case really highlights and then took into the court the harm that people are suffering through that use of that energy. We'll hear from all the panelists in this section, and then we'll turn it over to the audience for some questions. And Deepti, I wonder if I could turn next to you to hear a little bit, possibly more about coal, but also a little bit about gas in Mozambique.
Sure. Hi, everyone. Really good to be here. Hi. So many friends on the call today and so many new friends to make. My name is Deepti. I'm with Justiça Ambiental. That's how we pronounce it, Jen. Justiça. Justiça Ambiental basically means environmental justice in Portuguese, which is our national language here in Mozambique. JA is an organization which has been working for over 20 years on opposing unsustainable development in this country. And in particular, when we look at climate change and fossil fuels, we are one of the countries that is most impacted by the ravages of climate change. You have heard already in 2019, we had Cyclone Idai hit the coast of Mozambique. We have 3,000 kilometers along the Indian Ocean coast. Absolutely beautiful. But it also means that we are very vulnerable to climate changes, extreme climate events, Cyclone Idai, Cyclone Kenneth, Tropical Storm Filippo, Cyclone Anna. We will just keep naming it. The crises are getting deeper all across this country and all across this continent. And of course, that is hurting human health in very concrete ways that we need to be able to address. In particular, in Mozambique, it's not just that we are very climate prone, but also we are going down the path of creating more of the problem, contributing to the problem rather than the solution. Because in around 2004, the government started mining for coal or exploring the coal in Tet province, which is inland Mozambique, near the border with Malawi and Zimbabwe. And now, 20 years later, we have so much evidence from that region, from the lived experiences of people, from the soil and air and water tests, from what is going on in people's bodies in terms of the health impacts. We've had communities that were not even removed from the concession area when the coal mine started operating. So it started out with Vale, which is a coal mining company from Brazil, and Rio Tinto, and basically the companies keep selling to one another. At the moment, we have Jindal, which is an Indian company, International Coal Ventures Limited, and Vulcan. Val sold its shares to Vulcan, and at that time we really opposed the sale because we said, Val, you haven't addressed the crises that you created while being here. Now you just sell your assets and move on. Anyway, we're also talking about finances, about debt, about how all of these things are affecting the country as well. But in terms specifically of the health impacts, what we've seen in Tet province is that Jindal, for example, when Jindal started operating the coal mine with complete complicity from the government involvement, of course, they did not even remove people from the perimeter. So you had people living inside the concession area, which means the health was severely impacted because the coal dust, all of that they were facing every single day. They would put their clothes out. We have a photo. I'm sorry, I didn't prepare slides. We have a photo of someone's is drying their clothes, and just behind that you see the dynamite and the dust from the coal mine. So this is the state that people have been living in, and of course an extreme state of surveillance as well, because if they're living inside the coal mine, then their freedom of movement has also been impacted. So we're continuing to work with the communities in Tet province. At the same time, about 15 years ago, one of the biggest gas fields that was found at that time anywhere in the world was found off the coast of northern Mozambique, very, very north of Mozambique, just under Tanzania. And some of the companies operating there are Total from France, ExxonMobil, Eni from Italy, etc. What the gas has done in that province of Cabo Delgado is that it has, in addition to doing everything else, it has also provoked an insurgency, a massive insurgency in that province. So this textbook example of fossil fuels in Africa coming along with conflict and militarization and insurgency, we are seeing playing out in the north of Mozambique with heartbreaking consequences. So the health impacts of that, as you can imagine, all the communities who lost their lands and livelihoods are having a huge amount of impacts. The fisher folk, which used to be right at the sea and and that's how they get a lot of their protein source, for example, were taken and moved 10 kilometers inland without an option to be able to do their livelihoods. So the land and livelihoods was severely impacted with the insurgency and especially with the attack in Palma in 2021, March 2021, an attack so serious, it is the second biggest terrorist attack in the world after 9/11, 2001, but nobody talks about it. One result of the one result of the attack in Palma in 2021 was that Total, the company, did a force majeure. They left, and it's been 4 years, and they're now still trying to restart the project. So it was that the situation was that serious that Total did a force majeure and left. And 4 years later, this is still the situation. But what it caused in terms of human health and suffering is really atrocious, because we're talking about almost 1 million people internally displaced at some point in Cabo Delgado and in the neighboring provinces in Nampula and Niassa. So Justiça Ambiental, JA, has been working in Cabo Delgado with communities since 2006-7, working in Tet province since about 2004-5 with communities. And in Cabo Delgado, the situation of one of the things that we started looking at was nutrition, for example. When you're talking about almost 1 million internally displaced peoples, and an active war zone, a place with an active insurgency, what does it mean for nutrition? What does it mean for basic availability of nutrition and health for people? And the situation is really very, very dire. There's far more grave issues which are happening there, which is sexual assault. We're talking about humiliation and torture. There was an article published in Politico in September last year, which detailed one particular massacre and torture which happened. So I won't go into all of the details, but suffice to say, the social fabric of the community in Cabo Delgado and in Tet has been so severely impacted by the fossil fuel coming in and being exploited in this way without regard to human health, without regard to human dignity, without regard to human rights. This is what we are seeing in Mozambique, but not just in Mozambique. We're seeing this all across the continent. We're seeing this all across the world. And for us, we really want to link up with health professionals. I really love this work that Global Climate and Health Alliance is doing. So how can we work together, the health professionals on this continent and us, the environmental justice folks on this continent, communities who are directly being affected, whose bodies are directly being affected by these fossil fuel projects? It's an invitation. How can we work together to be able for us to be able to learn from you? What is it that you need to be able to do your work? And for the communities that we work with to have a life of dignity, how is it that we can work together on fighting fossil fuels and fighting for human health at the same time? So I'm really looking forward to the rest of this conversation. I'll stop there. There's a lot more to say about what's happening here, but just as a snapshot of what fossil fuels has done to human health and to the social fabric in these places in Mozambique and across the world that we need to join hands and fight against. I'll stop there. Thanks.
Thanks so much, Diti. And I wanted to highlight a couple things. One, just noting that the headquarters of the companies that are profiting from the extraction are not they're not in Africa. They're quite often in Europe. And so I think that that's one of the things that is concerning and galling, is that the harms are suffered by folks in Mozambique and South Africa, and the profits are quite often, some significant portion of the profits are not staying in those communities. And also just highlighting the sort of social health harms that can come with extraction. So we've heard an extraction site, we've heard an electricity site, but we're going to turn to broadly air pollution health harms, to Munir, who's based in Nigeria, who works with Urban Better as a run leader. And I wonder, Munir, if you could introduce yourself, share a little bit about why you were interested in getting involved with measuring air pollution, and what are some of the things that you are advocating for along with your colleagues at Urban Better.
Thank you, Jen. Good afternoon, everyone. So my name is Munir, and I'm a run leader at Urban Better, just like Jen rightly said. So I think the first thing that would hit you is when you look at the numbers, but then numbers a lot of times are meaningless without the stories behind them. And our numbers over here says that nationally, we have about 198,000 air pollution related deaths in Nigeria. But then on the individual level and how that affects me, that is what most matters, right? A few years before COVID, and I use COVID because COVID was a central turnaround to something very interesting. And I was using face masks way before 2020 because COVID made face masks like quite popular. And at the time, I was not aware, I was not really conscious of why I had to do that in terms of having the baseline knowledge of, oh, it's due to pollution, these are the basic issues. All I knew at the time was whenever I would go out without covering my nose, for example, and come back home, I would get sick every single time that would happen. So I began using face masks quite early on. And later, as I began getting more involved basically in the space, learning about air pollution, learning about how vehicular emissions and so many other sources of emissions, especially from cooking and the likes, actually affected the environment and how that also affected us, then it began to make sense. And I basically live in a city where can be vehicular pollution, it's like in your face. You don't have to imagine it, you don't have to guess, you don't even have to read any research paper. Once you step out, you see these things because there are a lot of old vehicles that are basically on the road and emit. There are a lot of not well maintained vehicles that are on the road that emit various forms of fumes and gases. These people daily. People live through these things. But then just the way I was not conscious enough years ago, a lot of people are still not conscious enough. Yes, this is their experiences. They see these things, they breathe these things, but then it's still not like a front burner issue for the city. And it's not just to the public itself. I remember with Urban Better, so that's kind of tells you how my interest brought me into the space. Basically, I discovered the work Urban Better was doing, and I thought, oh, this perfectly aligns. I have a personal story of how air pollution affects me. I could as well join this team and do something about the problem, right? So typically, what we do is to gather data. We have mobile sensors that we use. We go into communities, we go into places. There are reasons that inform what communities we go into, for example. But then once we go into these communities, we measure this data and we also speak to people like on ground to get their own personal experience with air pollution and why maybe if some of them are using firewood or coal to cook, for example, what some of the challenges with transitioning from that actually is. And this basically inform what we call an insights brief, which we share with stakeholders in government. And I was trying to mention the fact that the issue of living through the effect of air pollution and not being conscious of it does not just affect the layman, like the normal public. Even people in government, what our engagement taught us is they are not really aware of why this thing is important and how it is important. So my city, for example, a few years ago brought these new buses, PRC buses, brand new buses, very cool buses, air conditioned, all that, very low emission. You wouldn't even see they were like the best things on the road at that time. And a few years down the line, a lot of these buses, due to like a large lack of maintenance, they emit a lot of fumes. And these are not seen as problems. And I think one of the heaviest burden of our work has not been gathering data. Data has not been the most difficult part. It is the part of convincing people and helping people see that this thing is not normal, that just because you live in a city that normalizes some of these issues, just because you live in a city that normalizes you stepping out and you are getting on buses that emit very high amounts of carbon, then that is actually not normal. That is one of the most essential things and one of the biggest struggles that I've experienced personally on the project. Because yes, you do advocacy, yes, you engage people on the streets, yes, you show them the PM 2.5 data, for example, yes, you explain how it affects them, and some of them even tell you that yes, this thing affects me in this certain way, but then they still feel helpless, basically, in a way, to do anything about it, because there are a plethora of issues. There are a ton of issues that that come before air pollution and the air they breathe, right? And in a normal circumstance, this should top the list. But then a lot of people still do not see this as a problem that requires their attention. And this has been like a very huge part of the issues, some of the struggles basically around advocacy and ensuring that you can garner enough people to do that. And one of the ways we try to bridge that is while Jen was introducing me, she mentioned that I was a run leader. So that's not just a title. So a lot of times when we measure air quality, we do it, we run around the communities, we do these things, we run around the streets, the roads, and we combine physical exercises, right? Because Urban Better is like health focused, and it's basically a community trying to ensure that cities are safer and healthier. And that is one of our core. So we decided this is an interesting way to actually bring a lot of young people. Young people are interested in exercising, going to the gym, for example. The running community in Lagos is growing. It has been growing consistently for a few years and it is growing even bigger. So we see a lot of people are interested when you say, oh, we have a run, a clean air run, for example, as opposed to you saying, oh, we have a clean air, just a clean air campaign, just come and let's talk about clean air pollution. So there is an incentive for them, and that incentive is an interest that is very close to them. So through that serves more like a pipeline through which, oh, okay, you're here for this particular activity, but this is the core of the work we are doing. And we've been seeing a lot of young people in our communities. We've been seeing a lot of running clubs because we run with a ton of running clubs across our campaigns that we do. There is something we've been doing since January this year. So every month in Lagos, we run a full marathon. That is around the routes where the yearly marathon for the state actually holds. So the state has a Lagos City Marathon that it holds in February. And we are trying to basically compare the air quality of different months and determine if February is actually the best time to host marathons. Because we notice, and interestingly enough, on the day of the marathon, traffic is restricted, so there should be less fumes and less emissions on the road, right? That is the assumption. But then with our measurements so far, it has shown that the opposite is the case. There are certain days and certain months that we've measured so far where they are way, way better. Even with vehicles on the road, than on the day of the marathon itself in February. So, and that is where data is actually essential. It helps you like speak with facts. It helps you contextualize things. It helps you inquire deeper, because you say, okay, the major source of pollution is actually not on the road. Then why is the road, why do we still have large measures of emission? So that is one thing that data has basically helped us do. So as opposed to just telling government, for example, that, oh, our city is polluted. This is the problem. These are the solutions. We are bringing those numbers and showing them why it is actually polluted, and inquiring even further to find out what are the other sources that we are overlooking. What are the other reasons? Is it because it rained yesterday? Is that why the air pollution is better today? So we basically inquire on various levels. And as it stands right now, we've been engaging mostly with the state government in Lagos in terms of our engagements with government. And yes, in a way, they've been responsive, but action has been incredibly slow, as it is with most of the other actions we need, basically in climate action. We've noticed that yes, they are interested, they want to do some of these things, but then when it is time to take it a step further, then there is a bit of reluctance. But of course, we are willing to push through that reluctance and ensure that we are on them, because when you hit on an issue consistently and keep hitting and hitting and hitting, then they would actually listen and try to do something about it. I mentioned the issues about the buses getting old, the BRT buses that were introduced, even contributing more to the emission as it is today than when they were brought into the city. These are issues that we've been raising with them whenever we host our stakeholder workshops, even on social media. We do a lot of call outs, we do a lot of education where we tag them and tell them, okay, this is what you should be doing publicly. So we engage privately and we also engage publicly as well. So I think that is about 5 minutes. So I will just pause for questions that anyone might have. Yeah.
Thanks so much, Manir. I think your story is such a great example of feeling a health impact and then becoming someone who is both measuring and advocating around that health impact, and trying to educate your community and advocate with that community for things that will protect people, likely from air pollution that is stemming from fossil fuels. Vincent, if you want to briefly introduce Dr. Mbaiwa, please take the floor, and then we'll turn to the prof, and then we'll take a couple questions.
Yes. Yeah, thank you, Jen. Can you hear me?
Yep.
Yes. Oh, thank you. And our apology for coming a bit late. We had a special visit by the Ukrainian ambassador here and the vice chancellor from the University of Botswana. So we had to really dash off the meeting to come and join this special conversation. With me, I'm having Professor Joseph Mbaiwa here. He's professor of tourism studies at the Okavango Research Institute. As you know, that the Okavango Delta is one of the World Heritage Sites, well protected, and also there were issues around expropriation of oil and gases in the Delta. So Prof. Mbaiwa was one of the I should say the forefront people who really fought for such activities to happen. And the Okavango Research Institute kind of came up with a strong position paper looking at the effects or the impact those activities will cause in the environment as well as to the health of the people. So we'll share with us concerning that position paper and the concerns that were raised together with the health issues. So I'll quickly hand over to Prof. Mbaiwa to share your insights.
Thank you, Dr. Pagiwa. I think you can hear my voice.
Yes.
Thank you very much, and thank you for inviting me to come and talk to you. I very much appreciate the invitation. I have 4 to 5 minutes to speak. I will definitely do that. There was a lot of noise, or there's still a lot of noise or a lot of talk about the gas and the drilling of the gas, especially in Namibia, and also the same thing in Botswana. So that talk is still ongoing. and we have prospecting companies on the ground trying to get the oil, the gas, so that drilling should go on. But what I can say now is that the mining of all those has not yet started. We don't have it, but we have companies on the ground which are prospecting, and we don't know what will be the final result, whether they will be given approval or licenses by government to start mining or extracting the oil. But as an institute, as the Okavango Research Institute, when this thing was being talked about, we came up with a very strong position to say while we appreciate that a country should develop, a country should use the resources they have for economic development purposes, we also need to look into issues of environmental management, issues of health, and the like. And in our position paper, we talked about the potential results, environmental results, health results that can come from the mining of gas. Looking at the Okavango Delta itself, or Okavango River Basin itself, the basin has its origins in Angola, the river flows through Namibia into northern Botswana. We were simply saying one of the things that can happen is that in the event of a leak, and this oil finds its way into the Okavango River, what it means is that the river itself will be polluted. And once it's polluted like that, the whole life in the delta might be affected. And the whole life there we are referring to the wildlife itself, the birds, the insects, the fish, and finally the human life. Okavango River Basin on the Botswana part, supports or sustains almost 200,000 livelihoods. They rely on the Okavango River Basin. These are people who do fishing. These are the people who water their livestock in the Okavango River Basin, in addition to the tourism industry itself, which is relying on the biodiversity in the Okavango Delta. And the tourism industry is the second largest economic sector in Botswana. So we were saying, if at all our governments are to allow the extraction of the oil and gas, we need to look into the potential impacts which can happen. We are aware that in Namibia, they did the environmental impact assessment, and the environmental impact assessment in Namibia is already being challenged by some people to say it is not being observed, it is not being followed, such that some people have been relocated. We are told some of their farms have been relocated or they've been moved, and this affects livelihoods. So in Botswana, we are still lucky in the sense that nothing so far has taken place, but we're telling government to say we need a proper environmental impact assessment, a proper social impact assessment. And once those are undertaken, we need to have guidelines, and we need to have measures when it comes to issues of monitoring, who is to do what to stop the impacts. And the other thing that was clear was that the Okavango Delta is a World Heritage Site, a UNESCO World Heritage Site. And once it is a UNESCO World Heritage Site like that, coming up with mining of oil and gas, that status will go. The Delta will be listed in what we call a danger zone, and we don't want that to happen. We were assured that the oil and gas prospecting is almost 10 kilometers away from the buffer zone, from the delta. But to us in environment, 10 kilometers really is nothing in the event of an oil leakage. So we are simply challenging government to say, maybe we need to come up with a cost-benefit analysis of oil and gas and tourism on the other side and people's lives on the other side. So right now, what I can say is that we don't have that happening, and we believe it will not happen, and the lives and the health of the people will be saved. This is just in brief, in general, what I can say for now in the 4 minutes that I've been given. So I will stop so far and maybe also wait for questions. Thank you very much.
Thank you so much, Dr. Pagiwa and Dr. Mbaiwa, for making time, especially after such an illustrious previous visit. And thank you so much for that perspective. I know I promised questions now. We need to make a slight change in the agenda. We've got speakers who need to jump off at the top of the hour. And one of them I think brings a really unique perspective, because Dr. Fazia Rashid has been doing a lot of work to decarbonize health systems through the Aga Khan Development Network. And that has resulted not just in an emission of reductions, but I think I remember hearing her say also some real cost savings for health centers. And I think that will be really interesting to folks on this call. So Dr. Rashid, over to you.
Well, thank you very much. And I just wanted to say, Dr. Pagiwa, I really wish you all the very best with that project. It breaks my heart to think about the Delta giving its richness over to oil, gas, and mining and pollution. I really hope you succeed. Very interesting conversation. So our contribution is probably a little left field, but it has its place, I think. Yes, so the Aga Khan Health Services have facilities in a number of regions of the world, but in Africa, in Tanzania, and in 2 regions in Kenya, Kisumu and Mombasa, and spread over primary to tertiary levels of healthcare. And we started with looking at our emissions from the carbon perspective of joining the net zero movement in 2019. And I was tasked with leading that effort. And the first thing I did was to try and find out what our numbers were, because this is all new to everybody. And we succeeded. We developed a tool that made it simple, and it's now in use in countries all around the world with WHO's logo on it and so on. Available for free if anybody wants. But that was the starting point to try and identify what the hotspots were, what one could do to reduce carbon emissions. And the standard things that were recommended, we looked at and evaluated. And they were things like solar, which everybody's thought of, anything to do with reducing energy use, and diesel turns out to be the one thing we want to get off of in terms of energy and transition to cleaner energy forms, as well as anything you can do to reduce how much energy you actually use, which would mean looking at all the equipment, so one AC versus another, energy consumption, but also the types of refrigerant became another issue. And so we went through this process of identifying equipment we started off with. And we quickly saw that against our calculations of, okay, if we did this, what difference would it make with carbon emissions? It became very clear that our electricity bills were rocketing up, our diesel bills were rocketing up, and that anything we did to conserve use of energy would save money. So it was a no-brainer exercise to try and focus on quantifying the impacts of different interventions on carbon, and then looking at the return on investment in terms of cost. And what we found for all of our operations, and this is over 200 facilities in 8 countries, was that to reduce our footprint by 60%, the money that would cost, we would get back in under 6 years. And that was in 2022 when I did those calculations. At today's prices, it would be nearer 4 years. So when I went to the board, our board, with this analysis, their reaction normally would have been, oh, great idea. Go ahead, find the money, find a donor. But in this case, it was such a no-brainer financial case that they said, we will fund it. And so today, fast forward, it's 4 years on from then, we got the money, we've implemented for over 2 and a bit years, and our reductions in scope 1 and 2 are 47%, meaning we've nearly halved our carbon emissions. And now we're moving on, publishing all of that so that people can see that, you know, we're not making any false claims. We're doing it with the Lancet and other scientists. That is real results. Our next endeavor is going to be to quantify the business cases so that people can see just how simple this is. And without even going through the numbers, it makes sense just to get on and make these investments. So that's kind of our story, and much of it is already published. Anyone who wants to get more of it, I'll put in a generic email at the end of this. We are thinking of going forward more about the air pollution part. Understand this is a big theme here, and wondering about in our next level of investments whether we should, even though we can't do very much about it ourselves, although incineration is certainly one area that we've been looking at in terms of cleaning our own practice, and diesel, getting off diesel, is to have a monitor, and the value of having a monitor on all of our hospitals, which are public facing, on main roads, as part of the advocacy movement, just to support awareness raising. If anybody feels that is useful, please just say so, because there is a little bit of resistance by CEOs to do this, and I can understand that. But I'm quite sort of committed to the idea. But I'd like to know if other people feel that's a good idea, because there's no reason why we shouldn't have monitors on schools, on other public buildings, just for that, just to raise awareness. And I was very interested in the colleague from Citizens who was talking about how the assumption was made that pollution was coming from cars, and when the cars were stopped, that it was found that that didn't make a difference, and so it pointed the finger somewhere else. I think these things are, small, but may contribute to bigger issues. Yes, and I'll just stop there. That's really our story. Thank you very much.
Thank you so much for joining, Dr. Rashid. I know you have a very busy day, but again, I think it was so striking to me to hear the cost savings that were coming with switching away from using fossil fuels at health centers. Because again, I think it's they're often the most accessible energy, but perhaps not the most affordable energy. So your concrete evidence, I think, is very encouraging. We have more speakers who are needing to hop, so I think I'm going to again shift our question plan. If you've got burning questions, you can ask them in the chat, and then we'll maybe take all questions at the end. And again, in the interest of time, I was going to play a video, but instead I will share a video, sort of picking up on what Dr. Rashid was just talking about. We'd invited folks from MSF Nigeria to come and speak about their experience solarizing their clinics, because I think they had a similarly powerful experience about moving away from fossil fuels for what it meant for their sustained ability to provide electricity in really remote locations, and also their ability to get that electricity in ways that meant they were not as having as much tension with groups in conflict. So they didn't have to negotiate how they were going to get fuel, because they solarized. We couldn't get a speaker from MSF at this time, but the video is only 2 minutes. I encourage you to watch it. So we're going to continue with solutions. So we're fortunate to have Dean from Power Shift Africa and Sedley from the Fossil Fuel Non-Proliferation Treaty, who I think have a really strong vision for a just transition. So maybe Dean, I'll turn to you.
Hello. Hi, everyone. Hope you can all hear me.
Yeah,
all right,
we can.
awesome. Okay, thank you. So, speaking a lot around the solutions-oriented framework for this section, but I wanted to take a little bit of a twist in terms of how we tackle that. For us at Power Shift Africa, the solutions are also embedded in acknowledging the historical and current structural systematic issues that exist within the African continent that have fundamentally, triggered this ripple effect where there is, energy access issues, lack of development, and essentially, so looking at it from that lens, essentially, there's this idea, obviously, that Africa faces, intertwined challenges across how we understand the climate collapse and how we understand energy and how we also understand development, but also looking at it from a positive framework where we can, or we are growing to become a continent that can choose to formulate another development vision that builds on the rich tradition of African collective cultures that really breaks at the core, dependencies and indebtedness and fosters this idea of enhanced self-reliance. But more importantly, when we look at the structural crises, we understand that Africa essentially has about 3 of them that has really hindered our course to development, or how ideally we would like to understand development. One idea is, number one, the lack of energy sovereignty, which has led to the 600 million people lacking energy access. The other aspect is lack of clean cooking alternatives, which is, or rather a food crisis, which has been exacerbated by the lack of clean cooking alternatives. Yeah. And then essentially the third aspect is a low value import export market model. This one can really be exemplified through this idea of we have become producers of what we don't consume, and we consume what we don't produce. And that's where we currently stand as an African continent. So obviously the energy and food sovereignty aspect does reduce, unlocking these aspects, reduce dependence on foreign imports, which really fundamentally cater to genuine basic needs and also builds productive capacity. But looking at it from a much more holistic point of view, because of these structural differences, it's not by mistake, but essentially by design, where Africa continues to be at the global value, at the bottom of the global value food chain. And once we take that a step further, if we look at it at the dash for gas, according to the trajectory to where Africa is headed to, or gas being viewed as a transition fuel, there are many arguments around that. But more importantly for Africa, it's fundamentally us being put in a position where we are investing to what we've termed as financial fraud, because we are being asked to build out this gas infrastructure, which in 20 years would become a stranded asset, because it would not be, the entire world would have fundamentally transitioned into renewable energy. So essentially we wouldn't have any markets, be it may, if we fostered this idea around building out gas infrastructure. The other aspect is ownership. And ownership is a big question, because we've seen it for fossil fuels. Most of the industries in Africa are not Africa owned. If we look at Sangoma Phase, Orman, Woodside, which is an Australian company, owns about 70% control, leaving only under 18% to the Senegalese government. But most importantly, what ties in the economic argument and the ownership argument is pursuing a direction around fossil fuels. For example, if we give Nigeria as a case study, if they produce crude oil, that's not yet energy, right? So that crude oil has to be exported and refined, because we don't have the refining capacities. We sell that in nairas because of our trading in, because we are the Nigerian government. But once it's been refined, we buy it back as a complete product, but it's either being pegged in euros, in US dollars, or in pounds. And that does not take into consideration the fluctuation or the volatility of foreign currency and the exchange rates, essentially. So what that then causes is the economy not breaking even. And in order for us to then make up for the deficit made from actually producing a raw material that we don't have capacity to refine, we're not breaking even. We have to fundamentally borrow more from the World Bank. That's why caught in this big cycle of producing, and then we consume what we don't produce, but at the same time, we're actually buying these finished products at a market rate that is not really fair. And that has also been exacerbated by debt. So for example, again, let's use Nigeria as an example, even Senegal, because similarly, both countries have over 65% that they have to service against the gross domestic product, the GDP, leaving essentially under 35% to actually infuse in healthcare, in education, in infrastructure, in energy, any of the fundamental building blocks that you have to think about. Most African countries against the GDP only have an allocated 35% of their total GDP in order to allocate to those fundamental building blocks of development. So there's this big argument that we're trying to drive in around how that essentially is bad economics. The other key aspect, and I think, the health aspect, but I think one of the most striking narratives is the Niger Delta example, looking at it from a life expectancy point of view. Currently within the Niger Delta, the life expectancy is 42 years old, essentially. And that is really a result of the continued reliance in this relationship that Africa seems to be growing to have with fossil fuels, essentially. Yes, we've got every right to develop our natural resources, and that is definitely one narrative that has also been used by the industry to actually justify the use of oil, coal, and gas across the continent over the years. But one thing that people need to also acknowledge and take note of is that fossil fuels is not something that started 5 years ago. It's been ongoing, and Nigeria has had fossil fuels for over 50 years. So the idea of it unlocking development becomes null and void if we use Nigeria as an example. If we use Senegal as an example as well, 80% of the people are food insecure because of the deteriorating marine ecosystems due to fracking and gas exploration done off the coast of Senegal. So 80% of those coastal communities are food insecure. That is the idea of what development fundamentally looks like. And essentially, that is not the development that we are thriving for as a continent. We look at Mozambique, when gas was introduced, it was to tackle the 70% of people in Mozambique trying to tackle electricity access. That number has actually jumped to 72%. So 5 years later, since gas was introduced, we not only just don't have, we have a group of people who have no electricity access, but at the same time have an infrastructure that has caused a ripple effect, as the previous speaker, Dipti, has already mentioned, unlocking civil unrest as well. So we have to think of it looking at how Africa can go, for example, to becoming a food importer to food sovereignty by providing healthy and environmentally friendly food for all while cutting external dependency, and how looking at Africa having the agency and can invest in considerable resources, be it in renewable energy and social reproduction through their own means and currencies as well, thinking around the reformation of the global financial architecture. When we do get loans, why can it be that we are tapping into that through locally based local currency credit agencies? But that also speaks to a wider argument that we don't have sufficient credit rating agencies that are driven by the context of what it means to be in Africa and to be African as well. So that lack of that as well, it's also exacerbated this whole idea around debt and the type of finance that is required for us to actually understand what is needed when it comes to looking at the just transition. And I think maybe just to touch a little bit, and I think that would be my last input around how we understand the finance perspective. Looking at it from the idea of the African financing landscape, when we talk about a solutions-oriented approach, it already shows that the quality of finance flows are already inadequate and relative to its needs, and this does not really contribute to enabling justice within the transition. We look at the multilateral development banks that have been the primary providers of this climate-related finance flows, mainly debt to African governments. We also see another key player coming up, China, who's also a major lender on the continent, particularly to infrastructure. And a lot of the arguments around tapping into the asset value base around conceiving minerals and partnering with China, but also bearing in mind that China is also part of the problem in terms of how we understand the extractives industry and the role that they have played. So the dignity of finance provided to the continent, as I said, is already poor, and the flows are not. So equitably distributed in Africa, but they're rather concentrated in few countries. So for example, Egypt, Morocco, Nigeria, Kenya, Ethiopia, Mozambique seem to have this idea of this finance being provided, but the flows are not flowing equitably. And further evidence is that despite commitments to quantums and quality, countries experience many roadblocks in dignified access to the committed resources, making very little progress on climate goals. And that has been such a big issue. So looking at it lastly on these four aspects, that every country has a different relationship with fossil fuels. And this relationship is either high or low dependency on fossil fuels for development, including countries that have recent fossil fuel resources. So the relationship, dependency, and alternatives are the basis for current and future economic and socio-economic policies and investments. The other aspect that African countries have that asset base that I was talking about of transition minerals, and at present that financing for the just energy transition is decoupled from this asset base, which needs to be remedied because less than 1% of Africa's renewable energy potential is being realized, and the minerals needed to unlock potential are also needed by the continent. The third aspect is the vulnerabilities of countries to climate change reflect their environmental and social ambitions of energy transition. So for example, For countries highly dependent, there will be significant disruption to the social fabric of society through direct or indirect job losses or the closing down of small businesses and municipality impacts also. Such vulnerability influences financing needs across the African continent. Then lastly, financing just transition imply high ambition for quality and high quantity of finance without compromise. But to achieve this, plus the dignity in which such funding is made available to countries requires fundamental financial sector reform, including consideration of revenues and ownership models, as I've articulated, and funding that places communities and affected persons at the center of investments and risk decisions. Thank you very much. Back to you, Jen.
Thanks so much, Dean, for taking us through that, both the challenges with shifting, but also a pathway forward. And thanks for giving us your time. I know you've got a lot on your plate today. On that, again, I'm going to switch the order one more time and bring in Friday Perry, who's with AMREF Health Africa, just to make a few. So we had a few folks coming in to be health commentators, just coming in on what they had heard. And Friday is one of those people doing really incredible work with AMREF. So Friday, whatever time you've got for us, please come on in.
Thank you very much, Jane, and greetings to all on the call. Sorry that I will have to run, but I think I'll just take it from where Dean left, because I think he actually covered most of the things that have been involved in from my end, both, of course, working with AMREF Health Africa for the last 2 years now, and then before that, having been involved with the African Group of Negotiators, which I still do. So I understand the issues that Dean brought on the table, and exactly those are the issues that are currently happening, even within the negotiations, especially on the Just Transition Work Program. Africa's position, at least developed countries and all the developing countries under the G77 and China, have been arguing those cases that Dean mentioned, especially about finance, about the right for developing countries to develop the fossil fuel industry for purposes of sustainable development. Of course, when you bring about sustainable development and fossil fuels, the two cannot go along. But of course, they are saying if the financial mechanisms within the climate architecture are not coming through to countries that need them to be able to invest in efficient energy, clean cooking. You talked about Africa having over 600 people who are yet to access or to know what electricity is. We have over 900 million people who are not accessing clean cooking. And so you cannot bring about the just transition. These people are transitioning from where? From what? Because they do not know what electricity is or whatever it is that we're talking about in energy transition. So they say if someone doesn't have food, they'll eat anything. It's until a point when they have plenty, that's when they'll start making a choice on what to eat. And I think that's what is happening to Africa and most of the developing countries. But not to say that there are no health impacts. These health impacts are there. But people would rather go out there and expose themselves, maybe making $2-3 per day for their survival, than they forget about their health at that particular point. Those cases that have been talked about in South Africa, people exposing themselves, Nigeria, all those case studies that our colleagues have given, as a result that people look at survival first. The Maslow's law of hierarchical needs, you will look for survival first, the rest will follow. So I think the issue here is that those historical responsibilities that the developed countries have to support the developing countries with resources for climate action, which does not only talk about adaptation, but also efficient technologies for energy transition, should be given. Until that time happens, we will continue talking about the challenges that the fossil fuel sector is bringing to Africa, to Africa's health. Because truly speaking, even just in Zambia, where we have mining, we have a lot of pollution cases that come out, and we're talking about maybe over 7,000 premature deaths happening because of poor quality air. And so this is the reality of Africa. But until we change the narrative within the global climate processes. The money is given that is commiserate to the challenges that Africa has. We will continue having these vouchers, the fossil fuel companies coming and talking to our leaders, and eventually we'll see oil drills, oil wells being drilled or being opened and all that. It will not change because there is a challenge of resources. There is a challenge of survival. Until we deal with the challenge of survival, we will have a challenge of this health. We'll have the fossil fuel challenge still continuing haunting our health sector in most of our African countries. I think let me stop there. Thank you.
Thank you so much, Friday. And again, thanks for bringing the wealth of your experience. And I think that it actually works out well that we're transitioning to Seble next from the Fossil Fuel Non-Proliferation Treaty, because I think the treaty has been thinking a lot about how we move resources around to ensure that as people are accessing energy, perhaps for the first time, as Friday mentioned, we're doing everything we can to ensure that it's energy that's truly sustainable and health protective. So Seble, can I turn over to you?
Yes, hi Jen, and hi everyone. I hope you can hear me, and thanks so much for inviting me to join this conversation. So my name is Seble Samuel, and I'm based in Addis Ababa, Ethiopia. I'm part of the Fossil Fuel and Non-Proliferation Treaty team. I'm the head of Africa Campaigns and Advocacy. So I'll share a bit more about what the Fossil Fuel Treaty proposal is, but I just wanted to, I guess, contextualize a bit more the struggle to transition from fossil fuels to an equitable, renewable future across our continent that I know that so many of you have touched on really well. And I think it's important to show that the kind of examples that everyone's been sharing has been a historic pattern of our continent being carved up for coal mines and oil pipelines and gas flares, that, as many of you have said, it's for the profit and energy demands of distant and foreign nations and companies. I heard Dipti speaking about Eni and about Total, and some of you also mentioning a lot of other European companies like Shell and BP. Those are a handful of the foreign companies that are extracting wealth and energy out of the continent. And it's I think, as you were also sharing, Jen, more than 60% of the fossil fuel companies operating in Africa are headquartered outside of the continent. So we're seeing this continuation of the neo-colonial scramble for our resources, and that the majority of these are destined for export. And if you look at gas as an example, over 90% of the gas extracted in Africa is destined for export. And so these projects, despite very kind of dazzling, shining PR campaigns, they do not deliver on the promised returns. And instead, we have heard a lot of the human rights abuses that come from this, the debt entrapments, the polluted territories, the shortened life expectancies, the violence and militarization that happens. We heard Dipti speaking about terrorist attacks. So we're seeing the violence that comes from this industry, and of course, the health emergencies that you've all touched on that are left in its wake. And in addition, the majority of these projects are destined to become stranded assets, over 70% of the oil and gas projects. So this is diverting public money that could go towards health, that could go towards education, or could go towards climate action, that is instead driving this violence and displacement in our communities. And this kind of panorama or landscape of fossil fuel extraction has continued to lock us into energy poverty. It's more than 80% of the world's unelectrified population that is in sub-Saharan Africa. So over 600 million of us that are struggling to access electricity, and 1 billion that inhale toxic fumes every day from a lack of clean cooking, which is really driving also this 1 in 5 premature deaths from fossil fueled air pollution. And even if we look, I think Dean was also mentioning, at the powerhouses of fossil fuel extraction on our continent, like Angola or like Nigeria, these are populations that have still struggled to reach universal energy access using a fossil fuel model. Nigeria has one of the biggest energy access deficits in the world. There's over 80 million people who lack electricity access. Angola has around half of its population in energy poverty. So we cannot continue to believe this fallacy that we can electrify our populations with this model when we look at the biggest producers who have failed to do so. And the irony or the hypocrisy of this is that our continent is sat atop the largest renewable energy potential on Earth. It's almost 40% of the global share and 60% of the world's best solar resources. And if we look only at the wind potential, for example, that can satisfy Africa's energy needs 250 times over. And so it's every continent on Earth has a larger renewable energy potential compared to demand, but no continent has a higher potential than ours. And it's time to harness this potential now more than ever. But we see that globally we're headed very rapidly in the wrong direction, and that governments are on track to extract actually 110% more fossil fuels, more coal, oil, and gas than our climate kind of targets limit. And this is on track to reach that by 2030. And this is because many of the climate policies have been focused on reducing demand from fossil fuels and reducing emissions from fossil fuels while continuing to open new fossil fuel projects, open new coal mines, build new oil pipelines. And we know that this kind of hypocrisy cannot continue if we are to achieve our climate and our health targets, because the result is the world that we find ourselves in today with this dangerous overshoot on fossil fuel extraction. And this is where international cooperation plays a really vital role, because there's so many fossil fuel dependent developing nations that have large shares of their national economies or their energy supply or job creation coming from fossil fuels. And without international cooperation and finance and technology transfers and reparations, where polluters pay up and remediate also lands, a transition from fossil fuel dependency will not be possible. And so the fossil fuel treaty is kind of proposed to fit inside this policy void. And it's both, well, the full name is the Fossil Fuel Non-Proliferation Treaty. And it's both a campaign and a diplomatic initiative to address the policy void on this main cause of climate breakdown, which is coal, oil, and gas extraction that's responsible for almost 90% of the carbon emissions released in the last decade. And really deliver on a fair and financed transition from fossil fuels that can complement the Paris Agreement. Because we've seen, falling prices of renewable energy and expanding renewable energy, but despite that, actually fossil fuels have retained the lion's share of the global energy matrix over 80%, or around 80% over the last 15 years. And that's because we can't just leave the transition magically to the market to solve. There needs to be strong international cooperation and solidarity measures and mechanisms in place to have a phase out of fossil fuels that's equitable and to ensure finance for the transition. Because if we don't have those pieces of international cooperation with solidarity policies, we're left with an unmanaged transition, stranded assets, risks to workers and communities who depend on the fossil fuel industry, who would face a lot of price volatility and job insecurity, and also dangerous climate overshoots while fossil fuel monopolies consolidate a lot more power and will have more delays to renewable energy deployment, and economic diversification. So the fossil fuel treaty is proposed to kind of fill this void on fossil fuel phase out in the policy space, and complement the goals of the Paris Agreement that are concentrated on constraining fossil fuel demand and emissions by focusing on the root cause. So we're really trying to rein in the fossil fuel expansion to phase out coal, oil, and gas extraction and promote a transition that is fast, fair, and funded. So the fossil fuel treaty itself is not written yet, but because this will be developed by the participating nations, but it's grounded in 3 pillars. And those are a just transition, which kind of encapsulates financing and technology transfers for renewable energy deployment, for economic diversification, and alternative development pathways. And we're looking at a lot of different elements on just transition financing, including debt, which I think Dean was speaking about. Some countries, basically, their GDP is overwhelmed by debt repayments. Looking at replacing fossil fuel revenues, new forms of finance, and addressing constraints to fiscal space. And then we have a pillar on non-proliferation. So this means no new fossil fuel expansion, no new coal, oil, or gas exploration or extraction anywhere in the world. And then we have a pillar on fair phase out. So this is in line with climate targets. It emphasizes that the world's wealthiest nations who put us in the crisis that we're currently facing need to phase out first and fastest, while providing technical and financial support for fossil fuel dependent developing nations to transition at a slower pace. And the call for the fossil fuel treaty is gaining a lot of momentum. Many of the organizations on this call have been foundational in making the proposal kind of come into the world. There's over 4,000 organizations and institutions in nearly 120 countries that back the call. Among them is the World Health Organization. And yeah, again, just want to shout out to all of you on the call who have been just big powerhouses in building the momentum from so many different angles to make it a reality. And there's also support from other spaces, from over 1,000 parliamentarians, from more than 130 subnational governments, including some African capital cities like Freetown and Lilongwe, indigenous nations from the Amazon to the Maasai people, to indigenous communities around South Asia. I saw some academics on the chat, so support from over 3,000 scientists and academics and unions representing more than 30 million workers and over 600 faith groups around the world. So basically, we take inspiration from historic treaties that have tackled threats to humanity, like substances that deplete the ozone layer, chemical weapons, or landmines, where people power and parliamentarians and subnational governments with small, ambitious coalitions of nations actually shift these entrenched norms and legislation to overcome big threats. And we know we can do the same with fossil fuels. So just to finish up now, we're building this public and political momentum with the fossil fuel treaty. There's now backing from 16 global South nations from the Pacific, South Asia, the Caribbean, and Latin America. We're participating in discussions to set the rules and provisions and terms of what the fossil fuel treaty will entail. And we need to bring African governments also to the table. So this is not something that happens without us. And this is basically a movement to shift away from the violence and the dependency and the broken promises that have happened by design by the fossil fuel industry, and instead propel an equitable and cooperative transition where we can have distributed and community-owned renewable energy that delivers on the energy access needs that we desperately need for the continent, and sovereignty and justice for our communities. And that voices of health communities brings such like a level of gravitas and urgency and importance in these conversations. So having health communities alongside all of our collective voices is really essential to make that happen. So thank you so much. I'm sorry if I went over time. I know we're reaching the end, but thanks so much for inviting us here.
No, thank you so much for providing that hopeful vision. I think when we start out hearing what people and communities are suffering, and also feeling caught in this time of transition, it's really hopeful to hear treaty as a pathway to shifting finances and making it possible for people to have the energy they need. And I think also you mentioned it as well, like the funds that are going to subsidize fossil fuel companies could be going to fund improved healthcare. And we heard from Fazia that even healthcare funds could be perhaps used in better ways if we weren't spending so much on really expensive polluting energy. Okay, I booked too many speakers in my enthusiasm. I wanted everybody. So we aren't going to have time for verbal questions. We're going to hear from Lwando Mackie. Dr. Lwando Mackie from South Africa is currently the president, you can correct me, of the South African Medical Association. Also is a member of the Public Health Association of South Africa, the African Federation of Public Health Associations, and the African Epidemiological Association. And yeah, over to you.
Can you hear me?
Yep.
Great. Thank you so much for having me today. And it's the time of the day is quite busy for me, as you know, but I'm glad to be here today. The first things first, I'd like to say thank you to the organizers and for having this. I think it's very good to highlight in terms of what's happening on the continent. And also the speakers who've shared quite some very important points in terms of what's happening in terms of the impact of fossil fuels in the country. And it's not straightforward. In terms of the social determinants of health and trying to improve health and in terms of job creation and so forth, it's always a challenge. But it's true that in terms of the health impact that it has, it's very clear. And it's going to be an ongoing issue because we also have a crisis of leadership within Africa in terms of having one policy commitment meaningful participation in terms of civil society. And the third one is also in trying to develop more stimulus for one, job creation that is in more an environmentally friendly way, for looking at alternatives and more dynamic sustenance in terms of having more of an economic surplus within the country. And we're still going to have these challenges going further. And we need to make sure that we carry on this message throughout Africa. And in terms of the deaths that are happening, it's not just only directly to those affected by climate change, but it's still happening in the workers in the mines themselves. There's still respiratory lung disease that's happening. There's still also human trafficking related in terms of illegal mines within some of the war-torn areas happening in the Congo and other parts of Africa. We also have direct results of from the products from fossil fuels in terms of those cooking in their houses and hating that because there's no alternative electrical sources. And people have to try to keep warm, and people have to try to make sure that they do cook food and feed their families. And these are the ongoing challenges happening even in my country, South Africa itself, and also across the continent. And it's very important to make sure that these voices, which a lot of people have come here today and shared those stories of the communities. And these other stories, which I've mentioned in terms of the examples I've shared, which are not being shared today, are still shared and remembered throughout. There's a lot of more deaths that are not on the statistics. They're not part of the research programs in terms of having the data outputs, but they are happening throughout Africa. And we have to never stop the fight to try to help those who are in need and also the most dire in terms of income and have no other choice. In terms from a South African Medical Association type of hat, is that one, in terms of there's data which still has to be increased in terms of the impact of climate change, not only fossil fuels, on respiratory and cardiac disease within patients. Also, there's also other offshoot type of diseases that occur due to climate change, such as drought and leading to malnutrition, poor child development, and also directly mental health impacts of just not only climate change, but also the fossil fuels themselves indirectly. So the impact of climate change and the impact of fossil fuels is quite substantial across Africa and also globally. But one, it raises a point that there's not enough data coming from Africa in terms of research highlighting those things. And we need to try to improve as one academia to also from grants that are available in terms of the philanthropical space to support these initiatives for us to be able to develop that and be able to share that knowledge. Also, in terms of from a public health association type of that, there has to be increased conversations within not only just us in the health space. I've looked at the list and I wasn't sure in terms of how many government or employees within the public service actually attend these type of things. And it seems like we're talking to ourselves all the time, and and it's always a challenge, but we can't stop and we have to try to invite them. And I do appreciate different people who are online who've tried to reach out to those who are in policy to try to improve this. And it's something that we can't stop. As an organization, one is the health professional, as the Public Health Association of South Africa, we are definitely engaging in terms of trying to be involved in the NADLAC, which is basically a body which involves government and also business industry to try to drive in terms of not only climate, but also some of the non-communicable disease aspects of it. And we do have our chair of the working group and also members of the working group present here today. In terms of, from a global perspective at the World Federation of Public Health Association, we do try to support our members to try to improve not only in Africa through assistance at the African Federation of Public Health Association, but also for individual memberships. And it leads to my invitation to everyone that in 2026, next year, we are hosting the World Congress of Public Health in Cape Town. And we will have a climate and health track. And we want to have quite an exciting program for you. And I hope, and we've tried to make sure that it is very Afrocentric and very accessible to those in Africa. and not just only to have people who can only get visas or afford to come to South Africa be able to attend. So it's definitely for Africa, by Africa, hosting the world in the global village, and invite all of you to please do come. And I'd like to also end off with remembering that each action starts somewhere. And in terms of what's happening with this type of discussions, and also the work done by GCHA, the Public Health Association of South Africa, and all the other group members online here, that we are going to work slowly but surely towards achieving our goals. And please do reach out to me if you want to connect and be able to collaborate. I do encourage you to reach out to our chair who's online, Mafoko, for Public Health Association of South Africa. And also, if you want to engage with the African Federation of Public Health Association or the World Federation of Public Health Association in terms of climate change, please do give me an email. Jen has my contacts. And thank you so much. And thank you to each of the speakers. I really appreciate your contributions and taking the time out to come to speak to us. Thank you.
Thanks so much, Lwando. I know that you're in the midst of being a doctor and also teaching, so thanks for making time. And again, thank you to all of our speakers and also to you, the audience, who've joined us today. As Shweta said, this is what we hope is the beginning of a conversation. I've certainly learned a lot and really have enjoyed it. And thank you so much for being here. So I can stay on for another 5 or so minutes if any of the speakers wants to make a closing remark. But if not, again, thank you for being here. Thank you for the work that you do, for your wisdom and your insight. And we're really grateful that you joined us today.